PSC NURSE പുതിയ വീഡിയോയിലേക്ക് സ്വാഗതം. മെഡിക്കൽ സർജിക്കൽ നഴ്സിംഗിൽ ഇൻഡക്യുമെൻ്ററി സിസ്റ്റം പാർട്ട് 3 50 ചോദ്യങ്ങളും അവയുടെ ഉത്തരങ്ങളും ഈ വീഡിയോയിൽ ഉൾപ്പെടുത്തിയിരിക്കുന്നു. വീഡിയോ കാണുന്നവർ ചാനൽ സബ്സ്ക്രൈബ് ചെയ്യുകയും ഫ്രണ്ട്സിനെ ഷെയർ ചെയ്യുകയും ചെയ്യുക. നിങ്ങളുടെ വിലയേറിയ അഭിപ്രായങ്ങൾ, നിർദ്ദേശങ്ങൾ ഇവ കമൻറ്റ് ബോക്സിൽ രേഖപ്പെടുത്തുക. വീഡിയോ ഇഷ്ടപ്പെടുന്നവർ ലൈക്ക് ചെയ്യുകയും അല്ലാത്തവർ ഡിസ്ലൈക്ക് ചെയ്യുകയും ചെയ്യുക. നമുക്ക് വീഡിയോയിലേക്ക് കടക്കാം. Development of brittle spoon-shaped nail is called dash. Koilonychia. Fungal infection of the nail is dash. Onychomycosis. Burn injury in which there exists a zone of tissue injury on the outer ring consisting of tissues that is inflamed and vasodilated is dash. Zone of hyperemia. Affinity of carbon monoxide to body's hemoglobin when compared to oxygen is dash. 200 times. Dash burns are superficial and painful, appears red and heal on their own by epidermal cell regeneration within about 3 to 7 days. First degree partial thickness. Dash burns appear wet or blistered and are extremely painful but can heal on their own if they are small and do not become infected. Second degree partial thickness. Dash burns are characterized by damage throughout dermis, which appears dry and may be black, brown, white or ivory. Third degree full thickness burns. Scab or slough produced by action of heat on living tissue is eschar. Dash burns involve skin, fat, muscle and sometimes bones. Skin appears charred and may be completely burned away, requiring surgical debridement and grafting. Fourth degree full thickness burns. Clinical manifestation caused when carbon monoxide poisoning achieves 5 to 10%. Impaired visual acuity. Clinical manifestation that appears when carbon monoxide poisoning achieves 11 to 20% is dash. Headache. Clinical manifestation that appears when carbon monoxide poisoning achieves 21 to 30% is dash. Impaired dexterity. Clinical manifestation that appears when carbon monoxide poisoning achieves 31 to 40% is dash. Vomiting, dizziness and syncope. Clinical manifestation that appears when carbon monoxide poisoning achieves 41 to 50% is dash. Tachypnea and tachycardia. Clinical manifestation that appears when carbon monoxide poisoning achieves greater than 50% is dash. coma and death. Progressive stages of psychological alteration in burns patient is dash. Impact, treatment, retreat, acknowledgement, reconstructive period. The procedure of removal of dead burn tissue performed to restore areas exhibiting circulatory compromise is dash. Escharotomy. Dash is a tool introduced in 1940 for quick assessment of burn size. Rule of 9. Dash charts the percentage of body segments according to age and provides a more accurate estimate of burn size. Burn diagram. Evans fluid resuscitation formula in burn care includes use of normal saline 1 ml per kg percentage of burn, colloid 1 ml kg percentage dextrose in water 2 liters. Booker's formula in burn care in first 24 hours includes use of ringer lactate 1.5 ml per kg percentage of body, colloid 0.5 ml per kg percentage burn, 2000 ml dextrose in water. Modified Brooks formula for management of burns during first 24 hours includes dash burns. Ringer lactate 2 ml per kg percentage burn. Parkland formula for burns care involve use of dash in first 24 hours. Ringer lactate 4 ml per kg percentage burn. Hypertonic saline solution for burns care includes use of dash first 24 hours. Fluid containing 250 mEq of sodium per liter maintain hourly urine output of 70 ml per hour in adult. Dash is a procedure in which fascia is used in injuries caused by high voltage electricity or those with concomitant crush injury. Fasciotomy. Curare formula used in burn injured adult is 25 kilocalorie per kg body weight plus 40 kilocalorie x percentage of a surgical debridement procedure which involves removing of burn tissue and underlying fat down to fascia used in debridement of deep burns is dash. Facial excision. Facial നാകത്ത് FASCIAL എന്നാണ്. A surgical debridement procedure in which very thick layers of eschar are subsequently shaved until viable tissue is reached is tangential excision. Water-based creams used as topical antimicrobial agent in burn care are 1% silver sulfadiazine and magnesium acetate. Solutions used as antimicrobial agent topical in burn care are 5% magnesium acetate, 0.5% silver nitrate. Petroleum-based ointment used as an antimicrobial agent topically as burns care or bacitracin. Biologic temporary wound covering used in burns care are amnion or allograft, homograft, and xenograft or heterograft. Biosynthetic temporary wound covering used in burns care are dash integrated calcium agenates, transparent films, non-adhering gauze. Definitive wound care for full thickness burns in accomplished by autografting. Surgical removal of a superficial layer of patient's own unburned skin which is subsequently grafted to exist or clean and granulating burn wound is dash autografting. Autograft applied as a sheet or dash stretch graft. Autograft applied in a mesh form or dash meshed graft. An autograft in which a thicker layer of skin is removed consisting of epidermis and the dermis is called dash a full thickness graft. Increased angle between nail plate and nail base is called clubbing. Nail abnormality in which nail shape is concave or nail curves upward from nail bed is dash spoon shaped nail. Inflammation of skin fold at nail margin is dash paranoia. Linear red or brown streak in nail bed is dash splinter hemorrhage. Horizontal depression in nail plate depression can occur singly or in multiple is dash Bayes line. Nail shape which is convex and nail plate angle at approximately 160 is dash normal nail. Hair follicle inflammation is called dash folliculitis. Inflammation of pilosebaceous follicle is dash acine. Benign proliferation of melanocytes are called dash melanocytic navy or birthmarks or moles. Dark irregular patches in cheek, nose and forehead in pregnant woman is dash chloasma gravidarum. Loss of hair is called dash alopecia. Enclosed cyst in dermis is called dash sebaceous cyst. താങ്ക്സ് ഫോർ വാച്ചിങ്. PSC NURSEന്റെ വീഡിയോ കാണുന്നവർ ഇഷ്ടപ്പെടുന്നുവെങ്കിൽ ചാനൽ ലൈക്ക് ചെയ്യുകയും അല്ലാത്തവർ ഡിസ്ലൈക്ക് ചെയ്യുകയും ചെയ്യുക. വീഡിയോ കാണുന്നവർ ഈ ചാനൽ സബ്സ്ക്രൈബ് ചെയ്യുവാൻ ശ്രമിക്കുകയും ഫ്രണ്ട്സിന് ഷെയർ ചെയ്യുകയും ചെയ്യുക. നിങ്ങളുടെ അഭിപ്രായങ്ങളും നിർദ്ദേശങ്ങളും കമൻറ്റ് ബോക്സിൽ രേഖപ്പെടുത്തുക. അത് ഞങ്ങളെ ഇംപ്രൂവ് ചെയ്യുന്നതിന് സഹായിക്കും. എല്ലാവർക്കും വിജയാശംസകൾ. നന്ദി, നമസ്കാരം.